Welcome to Dateline Health. This is Fred Lippman coming to you from Nova Southeastern University. And I know that we recently had a program talking about the issues of breast cancer, but we had a lot of unfulfilled, shall we say, opportunities to ask questions. And since we had so many requests to get some answers, particularly in the area of plastic surgery, and particularly in the area of support systems and how nutrition and the control of your food intake and your environment is elemental to the care of yourself and to the issues relative to breast cancer. So what do? I bring the best I can find. Dr. Laura Sudarsky, who is involved with plastic surgery of the breast, and she's with eSSe, plastic surgery. Welcome. We had your partner here.
She's a great one to follow.
That's right. She was dynamic, and I'm sure you will be equally dynamic. Welcome aboard. Welcome.
Thank you.
And Sabrina Hernandez-Cano, who is a registered dietitian. And to tell you the truth, may I call you Sabrina?
Absolutely, please.
I don't know what the other acronyms are all about, but I know you're a co-author of a book, Experts in Pink, correct?
That's correct.
But tell us what those acronyms stand for.
I am a nutrition counselor, so I spend time also counseling people on behavioral changes, which is where usually everything starts. And then the other one is certified diabetes educator. In our community, we have an incredible increase over the last, I would say, 50 years of diabetes, metabolic syndrome. So I thought it was very important that I would specialize in diabetes. And I help people reduce factors there as well.
Well, I'll tell you what, we're going to bring you back for another show to talk about diabetes, but we're going to talk about breast cancer and the issue of plastic surgery. So, Dr. Sudarsky, let's sort of hinge on to your partner's conversations, because it was very interesting to hear of the new techniques involved in reconstruction. Let's talk a bit about your field of plastic surgery and the whole issue of breast cancer.
I think the whole issue and topic of reconstructive surgery is so important, because who would guess that even in this day and age, only about 40 to 50% of women get reconstruction. So that's only 1/2 of the population who's been diagnosed with breast cancer are given the opportunity for reconstruction. And there most recently was a bill that was passed through the federal legislation that requires everybody now to discuss breast reconstruction with patients who've been diagnosed with breast cancer, to try and avoid that skip, if you will, that women are not being offered breast reconstruction, or possibly don't have it available to them because they may be in a rural area. So in today's day and age, there's really no excuse why a woman should undergo cancer surgery of the breast. And as you say, it is defeminization, and wake up with nothing on their chest wall. So we have so many different options available to women to avoid that terrible trauma during the time of their cancer surgery. And it can be as simple as putting in a breast implant at the same time of the mastectomy, something called direct to implant, which, believe it or not, has only recently become very popular. Something a little bit more complicated, which is using a two-step reconstruction process, which is a tissue expander first, which is followed by a permanent implant, or something a little bit more complex, which is using your own tissue as a free tissue transfer from the tummy, the thigh, the back. So we have just so many options that a woman should be able to come off the operating room table and feel somewhat whole, and if not somewhat whole, at least have hope. And I try to explain it as it may be a work in progress. You may not come off the table and be completely finished with your reconstructive surgery, but you know you're a work in progress. And that, I think, gives a woman hope and gives her something to look forward to after the emotional ordeal.
You know, and we're going to get to you, Sabrina, very shortly on this, but we did have the conversation with your medical partner about the issue of the whole question of working with the oncologist at the time because usually there is that cohesive team that works together. In fact, we were talking about, the reconstructive nature occurring immediately after for example, a full mastectomy. It's interesting to see how important it is for you to have not only the knowledge, but I put it in the words, in oversimplistic words, the compassion, the willingness to communicate with the patient, because it is a traumatic event,
And it's very important to have that team approach, and it's the breast cancer surgeon, the surgical oncologist, the medical oncologist, radiation people, and the plastic surgeon. We all have to weigh in, because there are so many factors that will help determine which course is best for the patient in terms of reconstruction. If we know she's going to have radiation, we may alter our plan. If we know she's got to get immediately into chemotherapy, we're going to do a much less risky procedure because we don't want to have any complications that's going to delay her chemotherapy. So it is a complex circle. That's why the team is very important to have in place.
Well, that's what we spoke about, because the whole view of dealing with breast cancer today has changed so dramatically over the last 5 to 10 years, dramatically. And yet it's the team approach that is the winner, is definitely the winner, correct?
I agree 100%. It's also a difficult cancer to have because a lot of pressure is placed on the woman to make her decision. A lot of the procedures that can be performed will have the same long-term outcome, whether you choose to have a mastectomy or choose to have radiation and a lumpectomy. The long-term survival is the same, but it's huge change in how you're going to make your decision as to whether or not you're going to go with a lumpectomy or a mastectomy or even a double mastectomy. And it puts a tremendous amount of pressure on the woman to make a decision when she is really in no condition to make a decision, because she's just been told she either has cancer or possibly she has the genetic predisposition. She may be carrying the BRCA gene. So your whole life has been taken out from under you. Now you have to decide what operation to have. And I don't think there's very many other cancers that we deal with where the patient is put in the driver's seat to make so many complex decisions.
Well, Sabrina Hernandez-Cano, that's where you come in, I believe. So talk to us about it.
So you mentioned a traumatic event, and the doctor mentions still 40 to 50% of women who are not getting their breasts put back in. The person who I wrote the book with is the survivor. Her name is Cindy Papali, and we were having a conversation about this. She recently started wearing prosthesis and feels like, she says, I feel like a woman again. 18-year survivor, has been through so much, and she's finally starting to feel like with the Brockable Boutique offering these new bras that you can wear and actually put in a prosthesis. So she feels good again, and this is a conversation that we can continue to have to see if getting breast implants will be the right thing for her in the future, or what decisions she may have. But as far as nutrition goes, when a woman gets diagnosed with breast cancer, the first thing I see is a lot of fear. And I try to help them understand safety first, because the things I hear in my practice are pretty scary. People want to do alternative, complementary, and I'm okay with all that. But I think the most important message is, first and foremost, is to listen to your doctor, to your team. Listen to the group of people that are experts, that are going to guide you, because science has shown the right pathway. If you want to have complementary things added to your treatment, that's fine. But a lot of people today, with all this social media and all this education and information coming from everywhere, are scared, they're confused, and sometimes do things that can actually hurt them. Taking things that aren't scientifically proven to help you, denying cancer treatments such as chemotherapy and radiation because they think that they can have infusions and all kinds of crazy things put in. So the first thing I I try to do is help them feel comfortable, to lose the fear, and to know that if they follow their team and listen to their team, which should include a nutritionist, a registered and licensed dietitian. And I say registered and licensed because we are under the umbrella of doctors. We are under the umbrella of scientific evidence information. We're not just grabbing things that are unproven facts. So nutrition, super important. What kind of nutrition is the research is telling us today is helping people prevent risk factors. Prevention is paramount. Number one, reduce your weight. If you're carrying around excess fat mass, it's oxidative and it's inflammatory. So worrying about your weight is important, even after a breast diagnosis, in a safe manner, not doing crash diets, slow reduction of weight loss, 1 to 2 pounds per week. Being very cautious and mindful that if you're going to go through a chemotherapy, you may be nauseated, you may vomit, you may lose a lot of weight. So a lot of women come to me with morbid obesity, weighing a lot and saying, I want to lose weight. This is the time. This is what I know will help cure me. And I say yes, but you also have to remember that you're going to go through treatment that's very aggressive that may help you lose weight involuntarily. So there are so many complex issues to the weight problem. Obesity is growing at rampant rages, and it's awful. The year 2030, we expect half of our adolescents in the United States to be obese. And obesity is defined as a BMI, which is the relation between the height and the weight of 30 and above. So I encourage everybody to ask about their BMI. Have a conversation with your doctor, have a conversation with anybody that can calculate it yourself. You can go online and figure it out. It's not everything. BMI is not everything. BMI is simply the relation between height and weight. So if you happen to be very muscular and have too much weight on your body because you exercise, this is a good thing, but it can throw your BMI a little higher. So you have to go deeper in body composition and find out how much fat mass do I have in my body. And there's equipment and there are technicians, registered dietitians that can help you figure out how much fat do you carry in your body. We all need to know what our fit fat is. I've coined that in the last few years because people don't know how much muscle and how much fat mass is what makes up our total body weight. So we need to know what our fit fat is. We need to decrease the amount of calories that we're intaking as a nation. We have so much food available because of convenience over the last 50 years. That's what's brought on obesity. The research is there. It's convenience. We don't need to prepare food and spend half an hour in the kitchen. We grab and go all the time. And the calories are just there. And the quality of the calorie is also very important.
Let me interrupt you just for a second. I know that this is a very, very complex issue, and we've done shows on obesity, but I'd like to get to the issue of the breast cancer in individual, because the folks that wanted this show want to know what support they can get, whether it be nutritional, whether it be psychological, whether it be surgical, or otherwise relative to the cancer patient.
So there are many therapies nowadays. We included in this is our third book. So in this book, we were compelled to put in their music therapy. Music therapy helps people reduce stress. Stress is a huge risk factor for all types of cancers. So music therapy, we brought in yoga expert to speak about the importance of yoga, exercise, and these are some of the complementary things that we're adding to the book. Very important to get exercise. It's also another risk factor reduction. And getting back to the food and cancer, a lot of research on plant-based nutrition, lowering the amount of animal product that we eat, animal foods that we're eating is super important. Eating more superfoods, what are those? And I write an entire section on this, and it's the cruciferous, not just the plant foods, but the cruciferous vegetables such as broccoli. And for those who don't like broccoli, I have a recipe in the book called broccolini alla Houdini. You can actually make your broccoli disappear by shredding it with your mixer, your blender, and then you get tons and tons of antioxidants there. So getting to know more about how much antioxidants there are in foods is the latest trend, and I'm so glad knowing that an apple has 60 versus maybe kale, which may have 650 antioxidants. And just getting more greens into the diet is not only beneficial from a standpoint place of going through the nutrition through your cancer, but also from a preventative point of view. So a lot of greens, a lot of reds, the resveratrol. We didn't know these fancy, plant-based antioxidant names. 100 years ago, we knew vitamin C. Today, we know that in these foods, they're underneath a microscope, they're in the university. We have foods that actually have 26 antioxidants that can fight toxins on the cell. So wild blueberries, to name a few. So the brighter the color, the more beneficial for cancer patients and the survivor.
Where are the support systems? Okay, so you did the surgery, so you did the plastic work, you did the replacements, whatever, but they need something else. They need more than just the love of their family, et cetera, et cetera. Let's talk about it.
I think a lot of women get support from other women who have been through this. And actually, I don't want to zero in on women. I think we underestimate how catastrophic this is for a man and for a marriage. The husbands can do nothing. I think they would all rather lay down on the table and have their breasts operated on than have to sit by and watch their wives have the surgery. It's very difficult if you're a partner to watch your loved one undergo this kind of treatment. So I think family support is very important. We're lucky in our community to have this kind of support. We have an organization called BRCA Strong, which is based locally, that's becoming more of a national support system. We have Gilda's Club right here in Fort Lauderdale. There's the American Cancer Society has support groups. The hospitals all have support groups. Many practices also, the women who've undergone this kind of surgery form their own support groups. But as I had said before, because there's so much pressure put on the woman to make a decision, I think they need each other to help hold each other together to make these complex decisions. And for the men, what I have found is Gilda's Club has been very supportive for the men. They have their own men's support group there. But I think reaching out, and although I would agree that going on the internet can sometimes be harmful and not helpful when it comes to making medical decisions, I think for support, the internet is helpful.
How do you make the breast cancer survivor successful?
You have to be well nourished in order to go through any surgery, and specifically breast cancer of any type, but breast surgery as well. So good nutrition is important. You mentioned support groups, and the first thing that came to mind were the very young women who are getting diagnosed with breast cancer, and there is an excellent support group by Miss Hernandez, actually, not mine, but I remember her last name, and Y2B2 is their group, and it is specifically for women that are diagnosed very young. The other day I was in a community group, and I actually met a young lady that was 22 years old, diagnosed with breast cancer, has had her mastectomy. And so for people who are diagnosed very young, this group, Y2B2, is very important. Another excellent support group in our community is Bosom Buddies. They actually will talk to you 24 hours a day, 7 days a week. They will connect you with another woman who has breast cancer and guide you through all of this, as our book does as well. The survivor and I, we have open communication and lines for people to talk to us at any time when they are diagnosed or when they're going through their treatment or their surgery and they have fear. I was also touched with breast cancer. My mother had 11 years ago had breast cancer, so I had to go through the journey. That's what started the first book, along with Cindy, the survivor, with the book. So we're all learning as we go along, and the research is there to tell us that being properly nourished is super important. And people always ask me, well, what does that look like? What does a good nutrition look like? Nutrition, for years I've said, is not just the plate you put in front of you. And yes, a higher antioxidant plate that looks very colorful is going to be very good. But what else are you nourishing yourself with? Whether it be spiritually, mentally, physically. Physical activity is one of the most important antidepressants that my patients can grasp when they're in the middle of a diagnosis. There's nothing like going for a nature walk to make you feel better. You just come back and you don't know, but studies now say it, that if you actually exercise, it's like having an antidepressant. So the research is there. I encourage everybody that's going through a cancer diagnosis and treatment to go out, get fresh air, exercise, because it will immediately make you feel better. Sometimes you get caught up in the bed, you're sad, you're upset, you're depressed. Gotta get out and get some sunlight.
I agree. Dr. Sudarsky, we're down to the last 3 minutes of the show, and I want to just really firstly thank you and your partner for the magnificent surgical techniques and work that you guys, that both of you, I almost said you guys, that takes me back to my days in Brooklyn. But really, the medical techniques today are so different than they were 5 and 10 years ago. It's amazing. But I just want you to let the people know that are viewing this show that they should have less fear and less apprehension based upon these new techniques.
And I hope that's the take-home message from the show today. Don't be afraid. Breast cancer surgery should not be mutilating surgery, not in this day and age. It's not supposed to be. The reason you have to have tissue removed and the breast removed is to get rid of the cancer, but we have so many opportunities and alternatives for reconstruction that very few people should be turned away from reconstruction. And a woman needs to leave that operating room with hope, and hope that she is in the process of having reconstruction, she is in the process of getting well. And I think if you go in with that attitude of hope, I think it helps you feel much better, it helps you deal with your family, and it helps you take the next step into what has to be done to cure your cancer.
Well, that's what the folks wanted to know about. Sabrina Hernandez-Cano, we're going to bring you back because we want to talk about obesity, and obesity is a very big thing. But what's the name of the book that you wrote?
Experts in Pink, and we have many experts in our community who come out and talk about their, whether it's radiation, chemotherapy, surgery, nutrition, music therapy, yoga, physical activity, even psychological therapy. It's all there in the book to help guide. It's nonprofit. We give back to the community these books. It's there to help people like my mother, like Cindy, the survivor, and like all those women out there that unfortunately, get that breast cancer diagnosis. So reducing risk factors, increasing your plant-based diet is very important, and staying positive and very, very nurtured in all aspects of your life.
Positive like you, right? Okay, I got it. Well, thank you very much for being here.
Thank you for the invitation.
We certainly appreciate it, and we appreciate the hard work and your advocacy. I've always said this, I must have repeated it maybe 500 times on these various broadcasts, but advocates are the blessings that God has given us on earth. And you are, an advocate is a blessed person. So we thank you both for being advocates for not only the women that have come to you, or the men as well, have come to you for advice and consent relative to their nutrition, but again, Dr. Sudarsky, to you for the wonderful work that you do as a plastic surgeon and the reconstruction elements, which are really dominantly changed so much so over the last 5+ years. But I want to thank you too for your advocacy, your willingness to talk about it. So folks, that's where we are. You did ask the questions, and I'm glad that Dr. Sudarsky brought up the issue of what Congress did. I know, just to make it a quick story, since it's already past elections, it doesn't make any difference, but one of the victims, who was one of the sponsors of the bill, Congresswoman Debbie Wasserman Schultz, she's been a fighter for something that you just mentioned. So I don't think it should go unnoticed. It's not a political thing, it's a reality thing, so that's what it is. And I hope, folks, that you got some information that you had requested. Remember, if there's anything else that you want to know, we have the telephone number and an email address right here. And remember, as I always tell you, you got to take good care of yourself. And women and men, if there are, if you do a self-exam and there's a lump around or whatever, you got to get yourself to the doctor. Don't put it off. Don't put it off. And don't leave things out of when you get to the doctor's office and they give you these 5 pages and you get tired of checking everything off. You got to tell them everything. You got to tell them whether you're taking over-the-counter preparations. You got to tell them about your family history. You got to tell them about what your symptoms are. Don't hide it. Let them know. They're there to help you. So please remember that. This program is called Dateline Health. We come to you from Nova Southeastern University. And until next time, my name is Fred Lippman. See you.